My name is Jordan Applegate, and I will be presenting my patient SOAP note. Moses Sinclair is a 68-year-old male who was seen in the office today for a chief complaint of pain and weakness in his right hand and wrist. His pain began around 3 months ago and has been persistent every day. The location of this pain is in his right wrist and in the center of his right hand. He describes his pain as aching that gets worse throughout the day. The pain and weakness are constant throughout the day and is aggravated by constant and increased use of his hand. His pain is relieved by rubbing his hand at night and taking extra strength Tylenol every 4 hours. Other than taking Tylenol, he has only tried sticking his hand in ice cold water to treat his pain, which he deemed unsuccessful. He describes his aching pain as anywhere from a 2 to a 6 on a pain scale, with it worsening over the last couple of months. Mr. Sinclair takes Tylenol extra strength 2 pills every 4 hours every day for the past 3 months. He reports having no known allergies, and he denies having any past medical history, surgeries, or hospitalizations. His father has type 2 diabetes, and his mother had a stroke 10 years ago but is doing well today. Mr. Sinclair is married with 2 cats, and he works as a tailor altering men's suits for the past 30 years. He does not use tobacco or any other drugs. He reports having 2 glasses of wine a week with his wife at dinner time, and he reports feeling safe at home with a good support system. His review of systems is completely within normal limits, with the expectation to the pain and weakness in his right hand and wrist. He also disclosed stiffness of his neck occasionally after working long hours with his sewing machine. When conducting vital signs, the vital signs are as follows: temp of 99.6, pulse of 75, blood pressure of 134/64, respiratory rate of 20, height of 6 foot, weight of 195, and a BMI of 26.4. Upon the physical exam, his physical exam was completely within normal limits, with the exception of weakness and grip noted to the right hand, and a positive Tinel sign and Phalen's test. Palpation of cervical spine revealed no tenderness or masses. His cervical nerves 2 through 12 were intact. He presented with normal cervical spine range of motion, and there was noted diminished strength to his right hand. Otherwise, his upper extremities were within normal limits. In the clinic, we completed a range of motion test to his cervical spine and full range of motion test to his cervical spine. These came back within normal limits. His Phalen's test and Tinel sign, which were both positive. Neurologically, I assessed his sensation, his cranial nerves 2 through 12, and deep tendon reflexes, which were all within normal range. These diagnostic studies were meant to rule out differential diagnoses. Mr. Sinclair was diagnosed with carpal tunnel syndrome after full assessment of his wrist pain, a positive Phalen's test, and a positive Tinel sign. Differential diagnoses that were ruled out include arthritis, tendinitis, and stroke. However, swelling and inflammation was not appreciated on Mr. Sinclair's exam, which rules out arthritis. The positive Phalen's test, which is indicative of carpal tunnel syndrome, rules out tendinitis. Lastly, we needed to rule out stroke given his mother's history of one 10 years ago. Although he exhibited right hand weakness, Mr. Sinclair did not present with any facial drooping, speech difficulties, or confusion. This leads to the final diagnosis of carpal tunnel syndrome. Carpal tunnel syndrome is caused by the compression or squeezing of the median nerve that runs from the arm to the hand. Mr. Sinclair's job as a tailor is likely the cause of this pain due to the minute and repetitive movements he has to make. For the plan of care, Mr. Sinclair is being prescribed an orthopedic wrist brace to help neutralize his wrist. In conjunction, he should continue to take the extra strength Tylenol every 6 hours as needed, since it has proven to alleviate his pain. Mr. Sinclair was advised to take many breaks during work to allow his wrist to rest. He may need referral to a physical therapist if his symptoms do not resolve with over-the-counter pain relievers and the brace. Mr. Sinclair should continue to be seen for his annual checkups and maintain immunization status. He should be seen back in the office within 4 to 6 weeks if needed to ensure adequate pain relief and symptom management. Thank you.